Hi, everyone.
Hi, Mariana. How are you? What are you
Good.
trying?
Well, I'm very curious about talking about sedentary lifestyle. How, what do you know about a sedentary lifestyle?
Okay. Sedentary lifestyles is a lifestyle for many people that maybe they can moving, they can do exercise, and is due to many factors. For example, the people study a lot, or the people work a lot, and maybe customs too, or lack of opportunity. I don't know. There is a lot of reason. But this lifestyle is not an advisable point of um, lifestyle because has a lot of side effects. No? For example, cardiovascular disease, increase blood pressure, or increase the rate of diabetes and dyslipidemia, and maybe heart attacks. No? That's all class of diseases could be happening with that lifestyle. What do you mean?
Yeah. Well, obviously, sedentary lifestyle refers a lack of significant physical activity, right? And how can we explain the fact that sedentary lifestyle affect us in a range of chronic health conditions?
So with these lifestyles, so the people with the time increase weight, increase the frequency of diabetes, and this condition is a serious disease that increase the frequency of heart disease. I was saying, for example, atherosclerosis, and this is a problem that most of the people increase with the age. For example, the people between 20 and 30 years maybe represent 20% of the cholesterol or the atherosclerosis percent. And for example, the people between 50 and 60 years is most probably. So in this population, that frequency of heart attack is a lot. And you can evaluate it in all the hospital when the people acute, when the patient go to the emergency rooms.
Exactly. And there's a lot of recent research that is starting to confirm that the mental risks are associated with a sedentary lifestyle, and they can contribute to obesity, diabetes, type of cancer, cardiovascular disease, and early death, right? And
Yes, that's correct.
yeah,
But
eh,
what we can do for control it?
yeah. Well, I think it's important to maintain a good periods of good sleep. Also, try to reduce stress, do more exercises. Also, a good alimentation. What are other options or techniques
Yeah,
to reduce the
that's
sedentary
option.
lifestyle?
I agree with you that options are important, but all the time when the doctors advise to the patients, so always the first steps is a change of lifestyles. In this case, um, the people have to be active and maybe walk, for example, 30 or 60 minutes a day. The guidelines recommends walk at least 150 minutes on a week. It means 30 minutes every day, but during the rest of the day, you can be active. It is here. You have to be moving from another place to other, and don't stay sit most of the time. It's not advisable to be sit 2 hours. You have to move, or maybe go to the bathroom, upstairs or downstairs. I don't know that you can do. This is in that way, but in the other way, you have to change your diet. all that you eat is your diet. So in this case, you have to eat a healthy diet. Maybe I don't know if you know about it,
Yeah.
Mariana.
Yeah, I think that, well, in my case, I started when I was in the university. I started eating fast food, and that contributes of gain some weight and being sedentary and have mental and physical problems. So I perfectly know that good alimentation contributes with our well-being, right?
Yes, of course. But the physician advise all the time eats vegetables, fruits, whole grains, beans, olive oils, for example. No, this is a class of diet and a low salt and low red meats and so on. For example, that we do when both combinations about exercise and a healthy diet, you can get the first steps, and then you have to evaluate. You have to give some pills for control the glucose level or cholesterol levels. I don't know, or blood pressure level too.
Yeah. Well, in general, we can go to the conclusion that a sedentary lifestyle also appears to have a negative impact on well-being, right? And the combination of physical and mental impact to health makes a sedentary lifestyle particularly problematic. And in another hand, go to another item, we can talk about there's many things to cover in terms of well-being. For example, let's talk about good sleep.
Yeah,
We
at
can talk
least.
about uh-huh. We can talk
Yeah,
about some suggestions to help to create a healthy sleep routine.
yes, this is important because at least you have to take a rest of 7 hours, between 6 and 8 hours, but seven is a median. So it's important for get a good sleep. So another recommendation about it is to remove electronic device, for example, TV, computer,
Yeah.
smartphone. Maybe the physician recommends that don't get inside the room for get a relaxing sleep. Or avoid
Exactly.
consuming large meals too, for example. No?
Mm-hmm. It is also important to create a consistent sleep schedule, right? Because
Yes.
we have to go to bed and wake up at the same time every day, including the weekends, right? That this helps to regulate our body's internal clock.
Yeah. Some people's customs to sleep more during the weekends. So it's maybe sleeps 4 or 5 hours from Monday to Friday, and then can sleep 10 or more hours during the weekend. And
Mm-hmm.
reason to equilibrate that the quantity of hour to sleep.
It's also important to create a relaxing bedtime routine, right? Develop a calming pre-sleep routine, such as reading a book, taking a warm bath, or practicing relaxation exercises, right?
Yes, of course.
Well, we can talk about also about the limited exposure of or to screens, watch our diet, right? We can avoid large meals, caffeine, nicotine close to bedtime, and maybe
Alcohol too.
uh-huh, engage in regular physical activity, but try to finish your exercise at least few hours before go to bed.
Yes, 2 hours.
Yeah.
Yeah,
And
it's an excellent recommendations.
and to finish, maybe the last suggestions are limit naps. If you take a nap, keep it short, like 20 to 30 minutes, and avoid napping too close to bedtime, and watch our liquid intake. As you said, caffeine and alcohol are not good for us in terms of a good sleep, right?
Yes, of course. But how do you explain the fact that people consume in the parties a lot of meals and alcohol, and then get a profound sleep as it resembles that at least?
Yeah. Maybe we cannot feel the consequences at the beginning, but in long term, that affects our physical and mental health. So there's many things that we have to consider when we drink alcohol or smoke or um, practicing these things regularly, right?
Yes, of course.
Yeah,
So maybe we finish or
yeah. I think that's all.